Welcome back to another episode of Spilling the Tea with Dr. T.
And Gabriel D. and Lava Lee. Welcome back to another episode. Today we're going to be discussing something that actually you left in the comments requesting us to talk about. That's going to be the safety of oral sex.
Wow.
Yeah, and of course, oral sex is an important part of many
Yeah.
people's relationships and activities. And people want to know, is it safe? What are the precautions they should take? What are the risks, the pros, the cons? So I thought we would dive in and review all of those concerns for you. And then you can leave us comments below what you think. If you have additional questions, of course, we're always here to help. So what do you think? Oral sex?
I'm very excited about this one. A lot of people have commented before about oral sex. Can you please talk about oral sex? And here we are talking about oral sex.
All right, let's dive right in.
Well, let's dive right in. And first and foremost, can you define oral sex for us?
Right, so oral sex is considered the use of your mouth, lips, or tongue to stimulate your partner's genitalia. So this has been a part of culture and society for decades, hundreds of years, thousands of years. And of course, the way that we look at oral sex has changed over time and continues to change depending on what society is sort of implying or pressing on us at that time.
And so what are some of the pros or benefits of oral sex?
So there's some obvious benefits to oral sex like bonding or benefiting your relationship. And then, of course, there's also some personal health benefits to the practice. So we're going to dive in a little bit deeper there.
I knew there were some benefits to oral sex, and I can always count on you to tell us all the health benefits.
Exactly. So in regards to bonding or in a relationship, oral sex can be something that you can add into your routine to spice things up, or maybe that's your main type of sexual encounter that you have with your partner. Of course, it allows you to explore their body. It allows you to determine how you can stimulate their pleasure and create a positive space for the both of you to explore each other's bodies. And again, have an additional layer of sexuality that you can interplay together.
Absolutely, I agree. The more the merrier.
Exactly. And engaging in such a personal and sort of intimate expression of sexuality between your partner can increase intimacy, increase bonding, increase trust. And so all those things, of course, will translate into typically a happier and more satisfying relationship.
As we discussed here in previous episodes, a healthier sex life is correlated to healthy relationships.
Yeah, partners are going to feel more connected and more satisfied. And ultimately, that's the goal of any sort of relationship or couple bonding time or experience. And then in regards to personal health benefits, so any sort of sexual activity is going to increase endorphins, right? Or those hormones that make us feel good, things like oxytocin, things like dopamine. And so having regular releases of these hormones is going to overall make you a happier person, a more satisfied person. That oxytocin hormone is also really important for bonding. So again, you're bonding with yourself, you're bonding with your partner. And overall, clinical evidence has shown that the more release of these chemicals that are typically triggered by sex reduce our risk for developing chronic diseases as we get older. So high blood pressure, diabetes, anxiety, stress, depression can also be reduced by routine sexual activity and the release of these dopamine happy chemicals.
Sexual activity makes you live longer.
Yeah, it's cardio, like we talked about in a previous video, and it's also a way to bond with your partner, and releasing those chemicals is going to help to reduce your risk for chronic diseases as you get older. Absolutely.
The endorphins.
The endorphins.
What about some potential cons or risks related to oral sex?
Right, so this is probably going to be the most important area of the video for many people out there. So the main two areas you want to think about risk-wise is going to, of course, be number one, infection, because sexually transmitted infections can occur. And number two, putting yourself in a situation that you're not quite ready for. So the mental anguish that can come along with proceeding with sexual actions or oral sex if you're not quite ready.
Yes, safety first.
So when thinking about the health risks and potential infections, the main, STDs that you want to be concerned about are, of course, HIV, syphilis, gonorrhea, chlamydia, herpes, HPV, and there's other ones, but these are the main that you want to be concerned about. And of course, if you are practicing with someone you don't know, you are at risk because you don't know their sexual history. And so this may not be the best idea for a one-night stand or a rendezvous with someone you're not, very familiar with. Of course, things that can help, like barrier methods, using a dental dam or a condom, but they only protect you from certain STDs. So things like herpes, HPV, syphilis can actually go around the condom barrier only because other areas of the skin may experience a contact, skin-to-skin contact of the pubis or the oral area that's not being protected by the condom. And so you want to be aware that those things are potentially still going to impact you even if you use protection.
Wow, I always thought a barrier will protect you from everything?
Right. That's a great question because many people think that, yeah, it's some sort of plastic or some sort of barrier, but believe it or not, there are actually small pores within a condom that certain things can move in and out of. The best thing that they protect you from is going to be HIV, chlamydia, gonorrhea, those things that are going to get trapped into the barrier and prevent it from, causing you an infection.
But there's still some risks.
Exactly. And of course, the most important thing is if you have any abrasion or cut or sore on your mouth, your lips, your tongue, or the genitalia, you certainly don't want to proceed with any type of oral sexual contact, even if you're using a barrier or a condom. Just wait till it heals because you are going to be at much higher risk of developing an infection if there's an open sore.
You can always wait till it heal, and then you can resume your sexual activities.
Exactly. Same thing with herpes, right? So herpes is not easily protected using condoms, or HSV is the abbreviation for the virus. So you want to make sure that the partner does not have an open sore or an active lesion. Of course, HPV and HSV can be spread. So herpes and genital warts or the HPV virus can be spread with or without an expression of a wart or a type of lesion, but you're going to be at much lower risk if there's no signs of a wart or signs of sort of open lesion or anything that could look like an infection. So that's going to be also a part of it. You want to inspect each other a little bit just so you take a look before you dive in, so to speak.
That's a good strategy.
And then, of course, you want to consider the emotional and psychological impact of proceeding with sexual activities or oral sex specifically if you're not quite ready. So if you're in a relationship or your partner is putting pressure on you or you feel pressure yourself to proceed in something that you're not ready in, that's going to cause tension. That's going to cause some sort of misalignment of sort of what you expect sexually from each other. And of course, there's going to be a need to open up and communicate your feelings. So I strongly discourage you from proceeding in any type of activity, especially sexually related activities that you're not quite ready for.
Absolutely.
And if you're not ready, talk to your partner. Tell them your fears, your concerns. And if you feel like you can't talk to them, that may be a bigger issue at hand.
Yeah, I think dialogue is always the most important part of the sexual intercourse, because if you're not comfortable talking to your partner about what's going on, maybe there's a bigger issue at play.
Absolutely, yes.
And so what are some safe practices or recommendations when considering oral sex?
So the main considerations or safe practices that you want to implement when proceeding with oral sex is, number one, you want to communicate, which we kind of touched on a little bit. Number two, you want to protect yourself with barrier methods, condoms, dental dams. And number three, good hygiene. All of these things are going to be really important to reduce any cons or any risks or any negative outcomes from this activity with your partner. And as we previously just mentioned, it's really important that you outline what you're comfortable with, that you communicate effectively with your partner, the things that you like, don't like. Maybe if you've never had oral sex before, express that concern to them. Maybe if you've had it multiple times and know what you like and don't, you have the sort of blueprint there that you want to pass along. You really want to make sure that you're both very comfortable with the activity, because again, if someone is proceeding with something that they're not 100% sure that is best for them, if it doesn't go well, that's going to add more tension, more potential distrust or sort of fracture in the relationship. So certainly consent and communicate is going to be number one.
I feel like communication is such a big part of the sexual intercourse, and a lot of times sex talk is such a taboo and stigma, and we don't want to talk about what's going on with us to our partners because we feel ashamed or shy. But that's probably the most important part.
Yes, vulnerability, the ability to communicate your concerns. And again, we're taught so many years throughout our life, don't talk about sex, don't talk about sex. And then it ends up creating more conflict for us, which I think is the whole goal. Whoever's trying to prevent us from talking about sex wants us to not enjoy it, wants us to be scared of it, and wants to put us at a risk of developing poor outcomes. So we need to talk about it more.
Well, that's one of the reasons why we created this YouTube channel.
Exactly.
Talk about sex and educate people. Right, doctor?
Absolutely.
And
again, number two, those preventative methods or barrier methods that are going to help to reduce the risk of STDs or infection. You want to consider trying condoms, trying dental dams if you're at risk for developing HIV, gonorrhea, chlamydia. That's going to substantially reduce that risk. Other things, like I mentioned, do not get protected by condoms, but can still reduce the risk. An example, patients that have HSV or they're herpes positive, if they don't have an outbreak, of course, that's going to be the best time for them to proceed. If you are a negative partner and use a condom, it's definitely going to reduce your risk for developing HSV, but not 100%. And so those barrier methods are still effective, even though they're not highly effective against all STD types. It's still beneficial for you to use them if you're at any concern or risk for developing an infection.
And maybe you should consider getting tested as well.
Absolutely. If you are regularly or routinely, having sexual intercourse with one partner or multiple partners, it's highly recommended that you get STD screened regularly. The most important thing when you are visiting your doctor to get this screening done is you mentioned that you do perform oral sex, which is very difficult for many of us to say, but it's going to help because they need to swab the back of your throat and ensure that you've been adequately screened there. Because sometimes you can get tested for things like gonorrhea and chlamydia, where you urinate into a cup and they will test it and come back and say, oh, you're clear in that area, and so making sure you're getting swabbed and thoroughly tested is going to be really important as well.
Yeah, it's important to be thoroughly tested.
Absolutely. And of course, you want to also consider oral hygiene. If you are practicing oral sex, this is a major part of the system. And so you want to make sure you are seeing your dentist regularly, you are flossing regularly, you are brushing regularly. And of course, if you have any oral lesions, cuts, abrasions, even if you flossed recently and you don't floss regularly and you start bleeding, that is an open sore. So you want to make sure that heals completely before proceeding with oral sex, especially if it's just a one-night rendezvous, as we talk about regularly here.
All those steps seems a lot, but actually those are some of the basics.
Right. And these are things that you should be doing regularly, right? You don't want to start it all at once. And if you're late to the game, I get it. Flossing is not the most fun. Start a routine now when you're not about to go, proceed with oral sex. So that way, when you're ready to get there, you're already up to date with your hygiene recommendations.
I like that. Up to date with your recommendations. That makes sense.
Yeah.
So last but not least, what are some potential health benefits to oral sex?
Yes. So last but not least, the things that you're going to see health-wise that are going to benefit you from oral sex. Number one, those physical benefits, like the release of those happy chemicals, dopamine, oxytocin. They're going to help you to relax. They're going to reduce tension, reduce stress, anxiety, depression, and also encourage you to make this a part of your routine. Of course, those are the sort of dopamine, want to do it again chemicals. And so this may become more regular for you as, again, it's going to make you feel good. And number two, those bonding or relationship positive attributes. Of course, this is a very personal and intimate experience that you share with your partner, allows you to bond there, allows you to open your communication for things you like, don't like, and really open your perspective to the whole sexuality component of your relationship and being able to start to talk about sex. Again, something that's very difficult for a lot of us. But what do you think are other potential health benefits or risks of oral sex? Leave them in the comments below. We would love to hear from you. Overall, this is a great way to keep yourself healthy, keep yourself happy in your relationship. But of course, take those precautions as needed. We love talking about these things with you. We love to talk about sex and things that are maybe a little more taboo because, again, we didn't get that great education growing up. And I just started learning about it mostly in medical school and from other people that I was able to treat and interact with. So we hope to continue sharing this information.
If you haven't watched the other videos yet, please give it a try.
Give it a try.
And if you haven't subscribed yet, please subscribe, like, share, comment, give us recommendations, give us some love.
Yes. And we look forward to seeing you next week at another episode.
Talking about another thing, something probably related to
sex. We will see you then.
Bye.
Bye.